In this lecture, we will discuss the TA wave, specifically what it represents and how it appears on the EKG. The TA wave represents atrial repolarization. If you recall, ventricular repolarization is the T wave, so you can think of this atrial T wave as being a repolarization wave of the atria, okay? So TA wave being atrial T wave, okay? Atrial repolarization is what it represents. Now, something important to be aware of is that atrial depolarization and repolarization occur in the same direction, which is different from what we'll see in ventricular depolarization and repolarization. Okay, so it's different there in that ventricular wall. And because of this, we will see the orientation of the TA wave going in the opposite direction to the P wave. So if you take a look here, let's review our box diagram here of the heart and our electrical system. This is our sinus node, okay? We have our internodal pathways that then connect us to the AV node. Coming to that left side here is our Bachmann's bundle, okay? And then from the AV node, we have our His bundle. Through that, we get the right bundle branch. Then we have our left bundle branch that splits off into a left anterior fascicle and the left posterior fascicle, okay? And what we're saying here is we have depolarization that's starting here in the atrium, depolarizing the atria, and then afterwards, so here's our depolarization wave. After that, we then have a repolarization wave that comes through and it's heading in the same direction. So if you look here, imagine we're looking at our atrial wall going on here. We have our endocardium, the inner layer of the heart, and our epicardium, okay? And notice here we have a depolarization wave and then a repolarization wave that's following it. Imagine this right here is our electrode, okay? So we have a atrial depolarization wave, a positive wave heading towards our electrode, and because of that, we see these upright P waves in our EKG, okay? So imagine maybe we're looking at lead 2. So we see upright P waves. And then following that depolarization wave heading in the same direction, okay, we have a repolarization wave. But in this case, we have a repolarization wave considered more of a negative wave, okay? Leading with this negative end, heading also towards that electrode. And because of that, you can see a negatively deflected wave, okay? So that means it going down or in the opposite direction. Now, oftentimes the TA wave is not present because it is either too electrically insignificant to appear on the EKG or it's actually buried within the much larger QRS complex, okay? So again, this would be our TA wave, and if you actually see it, notice how we have the upward atrial depolarization, okay, and then we have this TA wave going in the opposite direction. But oftentimes you don't see that. In fact, you see this one where it's just a flat line, okay? And the TA wave, here's our P wave representing atrial depolarization. Our T wave or TA wave comes after it, and it can occur from any point here, from the beginning or the start of our PR segment all the way up to this point. And sometimes you oftentimes don't even see it, all right? So you'll just see a flat isoelectric line, all right? And it will be, if you do actually see it, it may appear either before or it could appear after and abnormally, decrease that ST segment. Now, one thing to note, and oftentimes you'll see this, is you won't actually see the TA wave because it's buried within our QRS complex, okay? Notice our QRS complex is much larger and it'll overcome that insignificant or at least smaller electrical activity of the atrial repolarization wave, okay? Now, cases in which the TA wave is present would be if there's no QRS after the P wave, such as an AV dissociation, or it may appear as PR depression or ST depression, such as in pericarditis, atrial infarction, or sinus tachycardia, okay? When you increase that sympathetic drive, it may also show up as sinus tachycardia by showing some of a depression here, okay, or some ST depression at that point. Remember the ST segments from this point to here, all right? Our PR segment is this area here, okay? Now, another thing to be aware of after much debate is that the PR segment has now been considered the reference point when we determine ST depression or ST elevation. And as a result, if the TA waves are present, you can see how it would affect the PR segment and even the ST segment, all right? So what I'm saying about this is there's been a lot of debate in the past of whether to use the TP segment, which is from here to this point. So this is our T wave, this is our P wave, so this is called the TP segment. Notice it's flat here. Using that or the PR segment. The PR segment was this to this. Okay, and using it to determine which is our actual baseline to be considering for ST depression or ST elevation. Okay, ST depression would be when this part would go down, the ST segment goes down. ST elevation is when this goes up. All right, so we want to know what is the baseline, and it's been after much debate that the PR segment is what we use as our baseline. Okay, but you can imagine if you have a big, right, TA wave. All right, so let's just take this off. Now, if you have a big TA wave occurring here, so it's like this point, all right, so now our baseline is no longer there. It may appear that this is actually elevated, okay? So we have ST elevation in that point. And you can see how the TA wave can be confusing at times, all right? And something more advanced, but just something to be aware of, is that the TA wave, where it occurs, and what it represents. So let's briefly review what we discussed. So the TA wave is the atrial T wave, meaning that it represents atrial repolarization. Remember, the T wave represents ventricular repolarization. So think of this as the atrial T wave. And what's interesting here is that atrial repolarization occurs in the same direction as atrial depolarization, all right? And the wave orientation will be in the opposite direction to atrial depolarization, right? We said that normally we have this positive depolarization wave heading to the electrode, so we see that upright positive P wave, and then we can have this repolarization wave that's a negative wave heading towards the electrode, and that's why if we see it, it'll be negative. But remember, oftentimes it is not visible, okay? Because either it's electrically insignificant or buried within that QRS complex that tends to dominate. Now, if we do see it, it could be present in when we don't have a QRS complex, okay? So meaning if we have something like this, we can see it actually appearing like this, all right? Or maybe it'll just go like this without any QRS complex there, so it won't overcome it. Now, that would be in the case of AV dissociation. That's one instance. Or it could present as PR depression and ST depression, all right? Remember, the TA wave can appear any point from here to here. And if it's going downwards, that's where we could have the PR depression, or it could extend all the way to this point where we would have the ST depression. That could be present in pericarditis, atrial infarcts, or even sinus tachycardia are some instances where we can see that PR depression or ST depression. Now remember, this, because the PR segment is considered the baseline that we use to measure ST elevation or ST depression, having this TA wave present can affect that baseline, all right? So that's just something to be aware of, more of an advanced topic, but I think you can handle it. Well, that's the end of this lecture. We discussed the TA wave, which represents atrial repolarization, specifically how it appears on the EKG and how it travels towards the electrode. I hope you learned something.